Thank you all for staying with us. What a fantastic first panel. They have really touched on a lot of the issues that we'll talk about from the institutional perspective for this panel number 2. But before we get going, let me introduce myself. I'm Dr. Michelle Jones-London. I'm the Chief of the Office of Programs to Enhance Neuroscience Workforce Diversity at the National Institute of Neurological Diseases and Stroke. And one of the things that my office does is to really try to incorporate and think about diversity and inclusion, not only at the level of undergraduate and graduate, where a lot of our programs are, but also, as we touched upon in the first panel, thinking about how we could do a better job of incorporating junior faculty. Today is all about a call to action for the entire neuroscience community to take this moment in time to really re-envision what we think a diverse, inclusive, and equitable community and training framework should look like, and how can we as a field drive the change and innovation in this space. As we talked as a group, we thought the focus should not just be on the challenges or the misguided notion that this new heightened awareness that everyone is feeling and sensing can just solve these issues alone. Having a heightened awareness, that's great, but in order to create the change, it's going to take actual work. And some of that work will be disruptive. It will take a disruption to really change the structural biases and the racism that are a part of our scientific ecosystems. What we've decided is that we'll take a positive approach to leveraging recent events to really encourage all stakeholders to do more, faster, and better, recognizing that we all have a role to play: individuals, institutions, scientific societies, and as a person who's representing one of the institutes at the NIH, federal organizations, we all are accountable and we all could be doing more and doing better at it. The panelists representing today their institutions, organizations, and societies, they don't have all the solutions, but they're here today to really continue this conversation in this space, as I said, from an institutional perspective. And really, the message to those are joining us today, especially to the trainees, should be that leadership and stakeholders hear your concerns, and we're really working to be the change. To Daniel's point, we don't want to be silent. Silence really is to be complicit. So the full bios are on the webpage of the panelists. So I've only introduced our panelists by the name, title, and affiliation. So in alphabetical order, and hopefully they can give you a little bit of a wave. The first we have is Dr. SHELLI AVENEVOLI. She is the Deputy Director for the National Institute of Mental Health. Next, we have Dr. Barry EVERITT. He's the Professor of Behavioral Neuroscience and Director of Research in the University of Cambridge. He's also the current president of the Society for Neuroscience. Dr. AYANA Jordan, she's the Associate Program Director of Yale's Psychiatry Residency Program. And Dr. Elizabeth McNeil, the medical lead for the Cerebral Adrenoleukodystrophy program at Bluebird Bio. Unfortunately, she's not able to be on the video, but she is joining us by phone. And then finally, Dr. SEGAL is a professor of neurobiology at the Harvard Medical School and the Dean of Graduate Education at Harvard Medical School. So let us jump right in. The first question that I'll put to a subset of the panelists is really something that I believe, came up a few times during panel 1. The fact that the burden of implementing change, although, whether it's a burden or something that, individuals want to do, it's still the fact that a lot of this change that we're asking for is often put on the backs of those most impacted by it. Or instead, when we're looking at the individual change, it's often framed as a remediation for these underrepresented individuals, not recognizing really that what needs to happen is more of this structural change. So the question that I have is, how do we promote anti-racist, equitable environments and create sustainable culture change at the institutional level? And I guess I'll first go to Dr. Jordan, if you can comment on that.
Thank you so much. I am deeply grateful to be here, and I'm happy to take the first stab at what I think is the age-old question in terms of what needs to happen to really dismantle institutional racism, but also requires the most kind of intellectual and really just action. And so many things. I think I want to start with Ijoma Olu, she's the author of the New York Times bestseller, So You Want to Talk About Race? And I found her very freeing and liberating, because she says the beauty of anti-racism work is that you don't have to pretend to be free of racism in order to be anti-racist. And really thinking about anti-racism is the commitment to fight racism wherever you find it. So I wanted to start with that because I think it frees people up to think that they can't engage in institutional change if they are thinking, oh no, I don't know enough, or I may somehow be a racist myself, or I don't have all the information. And what she's saying is just start somewhere, right? And really thinking about engaging in anti-racism work. And what that means in this present society, and definitely within medicine and science, because most of the people in the institutions that have the power tend to be a part of what we call the ideal identity. When we're thinking about that, we all know what it is, right? It's the white, heteronormative, Anglo-Saxon male. And the further you get away from that, the more difficult it is to leverage power. And oftentimes within institutions, you very rarely have power. So I would start with people in power acknowledging that in order for institutional change to occur, you have to leverage that power. Meaning it's not okay for you to remain as the head of said institution for 25, 30, and 40 years. You have to think about, how can I promote diverse voices to have a different outcome? What does that mean? That's going to mean that you can't do things the way that they've always been done. For instance, if there are no Black, full female professors, and that's just a random example that I'm using, at your institution who are tenured, you need to appoint someone to be involved in the tenure process, whether or not they exist yet, right? You just got to find someone to be involved in that committee, because there's no such thing as waiting on the pipeline. It doesn't exist, right? They're not there. So just figure out how you're going to be counterculture and do it. It might mean that you have to say, even though somebody wants to appoint me as the head of such and such committee, I need to look for other people who are not historically part of this ideal identity in order to be in charge of this committee that can infuse new energy. Otherwise, we'll continue doing the same thing and having the same result. So we have to do things differently. And I really wish that people will, and I'll stop talking, engage and think in not following the rules, but being creative and innovative and daring to do things differently.
Great points. Dr. SEGAL, I'll ask the same thing to you. How do we really get at this institutional culture change that is really going to end up we believe, making an impact.
Thank you very much. And I'm really honored to be part of this panel. So I think, as you had put the question earlier, one of the things that you highlighted was that we need to work at the institutional level without really adding a tax on the students and trainees in our institution who are Black students or are otherwise underrepresented students. And so how do we do it without making our students do the work and have an additional impediment to their success? And it's something I've been thinking about a lot, particularly this summer. The students are most aware of and really able to identify well the important issues that they're confronting. And from an institutional perspective, this is incredibly helpful. The students here and many institutions across the country wrote letters and really said, these are the things that we see that need to be changed. And I've been incredibly grateful to our students for putting those together and sending them to us. And obviously this was instigated by the murder of George Floyd and the reaction to that. What we don't want to do is make the students not only come up with what they need, but also with the answers. So what we are doing and what is taking those as these are the things that we need to change. And we know the institution as leaders of the institution, and how do we set up a plan for this? Most importantly, not just setting up a plan, but we're in the midst of taking those letters, putting them together in a plan with a timeline and a check-in. And so making that both the timeline and the check-ins public available to our students, so that we are saying we're holding our feet to the fire. You've shown us the way, but we're not making you develop the path and keep prompting us. We're going to keep making sure that we set ourselves up for accountability, and we don't make the effort or the accountability be on the back of the students. So I think a second way, again, answering that question of how does the institution change without making a further tax on our students, is in terms of hiring. We recently hired an associate director of diversity who is one of our recent graduates, and a student who had encountered a lot of difficulties and really, frankly, racism during her time as a student. She is taking that experience and her rapport with the students and really turning that into her career development and thinking about how she can take that knowledge and that deep knowledge and unfortunate experiences and use that to guide everyone as the rest of the administration in terms of how to move forward. Having just heard Kimberly on the previous panel, I just want to say the third thing that I think is really important is we're partnering with some of the HBCUs, particularly with Morehouse. Harvard has a long history, actually, of a partnership with Morehouse. And so we've been working with faculty there, particularly Peter McLeish, who is a graduate of the Harvard Neuroscience program, and also Morris Benaviste there, to really develop a partnership program between Harvard and Morehouse. And as we're developing this, we're really thinking of this as a collaborative and interactive program. And it's really benefiting both institutions Well, I know it's benefiting Harvard. I hope that Peter and Morris feel that it's also benefiting Morehouse, and I think they do. And that is a third way of doing it, where it's really taking institutional leadership and leveraging the HBCUs to improve our institution.
Fantastic. Thank you for that. And remember, people can continue to put your questions or comments on the website. So in order to bring in more of the panel, I'll throw out another question. One of the questions that we've thought about is really, how does your institution, your organization, or your society really demonstrate or communicate how diversity relates to the educational or research mission? And that it's not, I thought Kimberly did a fantastic job of talking about it. It's not just diversity by the numbers, really, that why we talk about diversity is the value for what it brings to inclusion. How do you relate that back to your mission? And for this, I'll start off with Dr. Everett, really sort of speaking from his role as the now president of SFN.
Thanks, Michelle, and thank you for inviting me to join this panel and to do so from the UK. In the mission statement from its founding 50 years ago, it stated very clearly that SFN will advance the understanding of the brain and the nervous system by bringing together scientists of diverse backgrounds and increase participation of scientists from diverse cultural, ethnic, and geographic backgrounds. And that's been consistent in its operation really for this last 50 years. And it's the case that SFN, within its diversity and inclusion strategy, does create education, networking, and professional development opportunities both during and outside the annual meeting to nurture and advance the needs of its diverse community. In terms of training, which is really what this part of the discussion concerns, I think it's our flagship diversity program, which is the NINDS-funded Neuroscience Scholars Program, which is particularly important. This has supported about 1,000 underrepresented minority researchers over the nearly 40 years that it's been running. And the program aims to increase the likelihood that diverse trainees who enter the neuroscience field continue in the field and advance their careers. And as we were hearing in the earlier discussion and just now, I mean, this is critical, and it's not happening properly yet, this continuation in their careers in departments and institutions. Now, the program itself, it's a 2-year online training program open to underrepresented graduate students and postdoctoral researchers. You have to be a citizen or permanent resident of the US and registered for a graduate degree or in a postdoctoral fellowship, and from an underrepresented minority in the biomedical, behavioral, clinical, and social sciences. And they have access to live events and webinars, educational resources, an online group for those seeking career connections and guidance from mentors and other NSP alumni. And there are some benefits from being a fellow in this program that include complimentary membership of SFN and travel awards to attend the meeting for those 2 years, enrichment funds to support professional development, and a mentoring team, and so on. And according to the data we have from a recent 30-year retrospective survey, about 70% of participating alumni reported that they have achieved high standing within academia, including full professorships and other faculty positions. And those not in academia have made significant progress elsewhere, such as industry and organizations such as NIH. So I think it's fair to say that NSP has made a difference, but I want to be absolutely transparent and realistic here about NSP, which is, while it provides, I think, an excellent training opportunity intended to enhance diversity in the neuroscience community, it's limited in scope. It admits just 18 fellows a year and a number of associates who have access to webinars and other resources. And I'm not sure that the NSP model is something that can be easily leveraged, but I think it possibly could be used as a model for mentorship and professional development support in institutions. And if we come back to this later, I can give an example that we have of where this has worked really rather well in the context of women in neuroscience. And of course, even though very good, a program like this cannot often by itself address the systemic problem of the underrepresentation of Black and ethnic minorities, of racism, in graduate and postdoc positions across the US, nor their severe underrepresentation in tenure track and tenured positions in institutions. Although it does, I think, help equip some of those at an early stage with skills that might help them achieve this progression. And in just sort of rounding off this, I would say that I think SFN, I mean, of course, it's dedicated to neuroscience, and professional societies in general, can play an important convening role, providing a space for members of the field to come together in numbers and talk about these issues, talk about what has worked and what hasn't, and commit to taking action moving forward. And we really welcome that and suggestions of how we can do it more and do it better. And I'll mention that our recent Black Lives Matter webinar, moderated by Joanne Berger-Sweeney at the beginning of July, had over 5,000 registrations and attendees and is still viewable online. And it's an example of one of the mechanisms that we can deploy to raise awareness and open the discussion to everybody. I can pause there if that's okay.
Yeah, let's bring in some other voices, but I think really a great point about what a society can do at a higher level to bring in sort of the visibility of the issue. And so Dr. AVENEVOLI, can you talk a little bit about, from the NIH perspective, how we are talking about diversity and how it comes back to the importance of our mission?
Absolutely. Thank you. First of all, thank you very much. I'm very honored to be part of this important discussion today and to follow from a wonderful panel one. So I'm going to talk a little bit about NIMH and a little bit about NIH. They overlap, and I'll try to highlight some of those emphasis. The mission of the National Institute of Mental Health is to transform the understanding and treatment of mental illnesses through basic and clinical research, paving the way for prevention, recovery, and cure. What is absolutely necessary is that diversity is critical for addressing our mission. Diversity of perspective is essential for advancing science and ultimately making the difference in people's lives that our mission focuses on. Moreover, we heard from panel one this morning that a biomedical research workforce is more likely to thrive and do well and make advances in environments that support equity, diversity, and inclusion. So let me first say that in NIH, we recognize that there are disparities, that we haven't solved all of the problems, but we also recognize that we're trying, and we have many programs out there and available to show that we are very committed to enhancing diversity, and we recognize there's always room to improve. I think that diversity of perspective is reflected broadly in the science we support, which these days is very transdisciplinary, really focuses on public-private partnerships. But more importantly and more relevant to our discussion today is we have many programs targeted at enhancing diversity, particularly for trainees. And these focus on various aspects of the pipeline, all the way from undergraduate, high school, really for high school opportunities, undergraduate, all the way through junior faculty opportunities. There are countless number of programs at the individual level, diversity supplements, F31s. I won't really have time to talk about all of those today, but I do want to highlight two of them that focus on neuroscience initiatives and programs for people from diverse backgrounds. And these are supported not just by NIMH, but from many of the Neuroscience Institute broadly through the Neuroscience Blueprint Initiative. Two of our stellar programs are the ENDURE program and the DSPAN program. The ENDURE program is enhancing neuroscience diversity through undergraduate research education experiences. And this program aims to provide individuals who are typically underrepresented with a training at the undergraduate level in preparation to enter and successfully complete neuroscience PhD programs. So it enhances the ability for them to compete and complete successfully. The DSPAN program, on the other hand, focuses on the pre to postdoctoral transition of diverse graduate students. So this is focused later in the pipeline. In addition, and in reflection to question 1 that Michelle raised today, we also recognize at NIH that we need sustainable culture change. So we can't just focus on our individual applicants for funding. We really need to be part of the solution for making the culture change, the systemic change that's critical. And just one example of that is a new program that we're starting called the FIRST program. This is the Faculty Institutional Recruitment for Sustainable Transformation program. It's actually, right now, what's on the street is a notice informing the public that this is becoming available. And it's, we're assuming it will be advertised this fall, the actual funding opportunity announcement. And receipt dates are probably going to be in November, so keep a lookout for that. So this program provides an opportunity for both highly resourced institutions as well as limited resourced institutions to develop and implement faculty cohort models for cluster hiring or the simultaneous hiring of a diverse group of research faculty. The goal here is to sustain institutional culture change, promote inclusive excellence by hiring a diverse cohort of faculty. But in addition to the hiring component, it will also focus very much on faculty development, mentoring, sponsorship, promotion. So some of the funding would come from NIH and some of the funding would come from the universities participating in this program. Like I said, we hope to have this published very soon, so keep an eye out for that. There are several other programs we've instituted around inclusive excellence, including the Distinguished Scholars Program. We have tools for implicit bias mitigation, et cetera, just to name a few. And just like Barry mentioned, while we have a number of programs that are promising and some that have proven successful in terms of individual trajectories, we recognize that it's not quite been enough yet. It's insufficient in the sense that there remain disparities in funding, there remain disparities in the workforce pipeline, and really disparities in health and healthcare access overall. And that is something that we are committed to improving upon. We don't have the answer, so we're here to participate in conversations like this to learn how we can do better. And we're very committed to working with, in partnership with other institutions and individuals to reach those goals. Thank you.
Yeah, thank you for that. And what I'll do is I'll put some links in the chat about the funding opportunities that SHELLI mentioned, and you can follow up with the different institutes for those programs. So finally, to sort of close out this panel, I'm going to come back to a question that we asked at the last panel, and that really is, you know, it's great to talk about these supportive statements, but people are really ready for concrete action plans. And so in broad strokes, I'd like to bring in our last panelist and really ask her, Dr. McNeil, you know, as you reflect, what would success look like for you in this space in a 2-year, 5-year, or even a 10-year horizon? What do you think that would look like?
Okay, first of all, let me thank you for allowing me to participate. I'm sorry I can't be on video to join you, but I'm definitely with you in spirit. I think that I'd reflect one thing that was said in the first panel, that we'd have people of various ethnicities stay in science and be happy. And I would add in that I would like there to be a day when no one's surprised when a person of color presents at a scientific meeting. Nobody questions, oh my gosh, how did they get that? What sort of extra help do they get? It's just accepted that that's Dr. So-and-so presenting on X, and nobody blinks an eye. When there's a total acceptance, that would be success. I don't think that'll happen in the next 2 years, though. That may be down the road. But,
Yeah.
you know, it's because right now, and I admittedly do it myself, you know, I'll be at a scientific conference and a person of color, and I have this sort of thrill of, wow, look at that. But I shouldn't have that. I should just be able to say, It's like, it shouldn't come as a pleasant surprise. It should just be an accepted part of, oh, okay, that's Dr. So-and-so. And I think the problem is a surprise because I'm not used to seeing it. So I guess what I'm saying is that I should be used to seeing it. It shouldn't stand out in any way. I think the way we can get there is I do think there's got to be some individual actions taken. And there are 4 clear areas for me. So one is hiring, and these are some of the things you've heard before. But when people get grants, when people in academics get promotions, some of the things you look at is how they mentor others. Well, I think we need a little more granularity. So when we look at, for any given department, who they're hiring, how many people of how many diverse people were interviewed, how many diverse people were offered a position. And I want you to break it down at the levels. So therefore, if someone has 50 employees and they say, oh, 25 of them are people of color, well, are any of those 25 people at your executive level? Are any of them at the level just below executive? You know, are they randomly distributed throughout the population? Second is development, looking at the opportunities that this mentor is offering to students. And I would say that anybody who's coming up for promotion who has students who they are mentoring, I want them to tell me all of the opportunities that they've offered to the students they're mentoring. And the reason I say all is because if you just hear that, oh, Dr. So-and-so offered persons of color 3 different development opportunities, that may sound great until you realize that everyone else was offered 10 different opportunities. So you kind of have to see the entire group in order to put things into context. When it comes to promotion, not everyone will be promoted at the same time. But if you're not going to promote someone, you need to give them an action plan. And it has to have some granularity. And this is something that can be done in academics, in the government, in industry. Because if you're saying you're not promoting them because they haven't given enough talks or something, that's something that they can actually work on. If you say it's just, I don't know about their presentation skills, well, that's a little vaguer, and they don't really know what to do with that. So I think you need to have a granular action program to help people move forward. And that also holds you accountable, because if you have an action plan and they are able to actually meet the things listed on that plan, then why are you still not promoting them? Retention. What are you doing to keep people there? Why are people leaving? There's always a reason why people leave. Now, some people may be leaving because there's a better opportunity down the road. But what about that opportunity that they're leaving for makes it better? Why couldn't you give them what they're getting down the road at the place where they are now? So I think that some of what I will see as a step on the way to success is that greater granularity and the greater recognition of how am I doing and what am I measuring success against? And at this time, I don't think that's always done as clearly. And I think that some of it also has to be in the response to applicants. I think applicants who are not accepted should also get the courtesy of a detailed description of what they can do to make changes. And that means that the person who's rejecting them actually has to sit down and think about it, as opposed to being allowed to get away with sort of vague descriptions that may actually just be covering up some sort of implicit racism.
Wow.
And I think I talked a little too long, so.
No. I think you gave us really, really great comments and really, really things that we can move it into the question and answer period. And I think a lot of these things we can digest there as well. I think, but yeah, great comments, Dr. McNeil. So I'm gonna turn this over to Dr. Bros, who will read some of the questions. And I believe the questions are open not only to the panelists from panel 2, but panel 1 as well. But maybe we'll start with panel 2 questions.
Yeah, let me just briefly introduce myself. I'm Katy Bros. I am one of the co-chairs along with Roz SEGAL, who's on the call, and Rita Ballas-Gordon, who's on the call but not visible, of the Action Collaborative that has organized this webinar. And I'm a science program officer at the Chan-Zuckerberg Initiative, also trained neuroscientist. I was in science publishing for a long time before moving into philanthropy. So I'm going to try to distill some of the themes of the questions and then perhaps ask some just verbatim from the questions. And again, as Michelle said, you're welcome to add comments and questions to the online forum, and the panelists are going to be answering those after the webinar as well. And so for the first question, this is general to the panel, but then I'll direct it to some of the panelists. I wanted to talk a little bit about, one of the kind of, I would say, like meta issues about why diversity and inclusion matters, why having a diverse and inclusive workforce, whether in neuroscience, science, or in general, matters. And that is, I think, something that was alluded to already, is the disproportionate impact of disease on Black and Brown communities. And we see this obviously in spades during the COVID-19 crisis, but I think coming from a neuroscience perspective, we also know that many neurological diseases affect Black and Brown populations disproportionately. And I think there's an underlying question here of how does, and who's at the table or the lab bench or in the clinic doing the science, sort of developing treatments, deciding how we ask research questions that have translational implications, like who's doing that, and how does that impact what questions get asked in the first place? And I want to turn this first maybe to AYANA, coming from a medical perspective, but also I know you have an opinion on some of this, and there was a specific question about whether the panelists would be willing to comment on the 2019 report from Hopp et al. That had looked at how topic choice might relate to percentage of NIH funding as related to minority scientists. And I know you have an opinion on this. I'd like the NIH to also comment on it. But to more generally address the question of who has a seat at the table in deciding kind of what questions are asked, how those questions are asked, really kind of influence ultimately, what questions get asked.
Yeah, no, I appreciate that. There's so many things that I need to say. First of all, I just want to kind of go back to the first point of really, and I am deeply appreciative of tight pipeline programs and also societies having minority groups, but that is not enough, period. If it was enough, we would not have the continued disparities that we see, some of which are worse than they were in the 1970s. So again, we have to break away from continuing to do the same things and expecting a different result. Pipeline programs ain't it. Not going to cut it. We can talk about diversity, we can talk about inclusion, but what we're forgetting is belonging. You can put me there, you can invite me to the party, but if I don't feel included, if I don't see anybody that looks like me, if you're not understanding what it means to be the only, if you don't experience my pain or my pleasure, in a world that is not respectful of the humanity, no, it doesn't matter how many pipeline programs you have, no one is going to stay. So we have to just be very honest about that. And then, so that's the first thing. Diversity and inclusion for sure, but also belonging. So we can't wait until 10, 15, even 5 years until those people get to the through the pipeline because we know more than likely they're going to leave because there's no sense of belonging, okay? And so again, really challenging us to push past that. So then when we think about, well, what is in place to make people feel like they even have a chance? We have to be very honest in the inherent racism that's in the existing structures. So when we're thinking about tenure, it doesn't even make sense to think about just putting Black and brown people at the table, which is important, but thinking about who is deciding what constitutes as having value, right? So you have to have people who look like the populations who are being adversely affected to be able to have some say in how the research questions are even being asked. And that will never happen if we continue in these inherently racist systems. So for instance, when you have a paper that comes out in Science that says there is a persistent disparity gap in funding for Black researchers, Black scientists, and the entire article doesn't mention racism as a likely contributor, that's a major problem. When you have a press release from the director of the National Institutes of Health say that he is surprised by this persistent funding gap amongst Black scientists, that shows you how divorced we are, no matter how many DEI efforts we have. Because anybody that has been paying attention, anybody with lived experience that has been in science who knows that is not a surprise that Black and brown researchers are not getting funding. There's a Science article that came out in 2011. Black investigators are less likely to get R01s on their first or second attempts. You can control for background, origin, training, previous research records, publication. We're still not likely to get it. So then we have to be clear about the pervasiveness of racism and realizing that we cannot continue amongst the existing system. It's not going to work. So it's beyond research topic choice. It's beyond putting Black and brown folks at the table. We have to restructure the entire system. So that means leveraging power, people who are in charge of chairs and NIH institutes and committees have to step aside and say, we haven't done well because we don't know what we're doing, because we don't have the expertise in being oppressed and marginalized. We don't know what it feels like to not to be a part of the experience of, yes, COVID is disproportionately affecting Black and brown communities, but that Black and brown community is my mother and my sister. And so I have inherent need to figure this out, right? So we have to say there should not be any study sections that can exist if they are all white. That shouldn't be able to happen. It's continuing to happen. You shouldn't be able to continue to publish about disproportionate impacts on minority communities and not have any Black or brown scientists engaged in the research. You shouldn't be able to get funded for clinical trials that look at disparities in addiction, that's my field, in whatever subspecialty you want, and not have people from that group involved in the trial. People always say, how do you get so many people Black people to be involved in your trials? It's not magic. It's that I'm in the community, I know the community, I was raised in that community. I have inherent buy-in and understand deeply that these numbers translate to my auntie, to my mom, to my father. And so the systems at play leave me out. So it's like, I have to create another system, or folks who have power that tend to be white, like I said, part of the ideal identity, have to be serious about being anti-racist, stepping aside and saying, let me give you a go at it, because I'll never understand, right? And so these are the things that are just infuriating, because I am I participate in so many of these talks, and people have great intentions. But if you continue to allow systems of oppression to dictate what the currency is that's going to relate to my promotion, it's never going to happen. So for instance, for me, I don't care about your publication record. And that's honest to goodness, the truth. What I care about is similar to what Dr. McNeil said. How many Black and brown people did you mentor? What is the work that you've done in the community to show that you've been able to translate your basic science work so that people understand how to protect themselves from illness? What is the anti-racism work that you've been doing? Let me see that dossier. What scholarship have you done on that? None of these are seriously being considered in many of the panels, and it's unacceptable. And if we genuinely believe, and I know I gotta be quiet, but if we genuinely believe that racism and race is man-made and it's a biological construct, then that it forces us to look inward to say, how can we give opportunities to people who are not a part of that ideal identity so that they are able to solve the problems that affect oppressed folks, and in this country it's Black and brown folks, in the same way and in the same privileges that white folks have. And until we do that, we can continue to talk about training and pipeline programs, but we have to say enough. Give Black and brown people the same opportunities. If they haven't done the work, just appoint them. They'll get the mentoring. You gotta move aside.
That's great. Thank you, Ayana. I think maybe to kind of bring in some other voices here, does anyone want to kind of bring in comments on maybe the issue of like evaluation, sort of how we decide? I think Ayana sort of referred to that as well. How do we decide how papers are published, how grants are funded, who gets tenure? How do we make that a more inclusive and diverse set of decisions? I think maybe Michelle or SHELLI from the NIH, can you maybe say a little bit about how you all are thinking about that with respect to grants? And Roz, maybe you could pipe in with respect to decisions around faculty.
Sure. With regard to funding, it's been a complex history. And like Ayana, we've been aware of these issues for a long time. And aside from the pipeline programs, which I completely agree with, they have limited value in the big picture. We've had a number of advisory councils, work groups advising our NIH council, also advisory councils to specific institutes that have helped try to lay out plans, which are not just about the pipeline programs, but about enhancing the workforce, beating down barriers, promoting, people of color within organizations. And I still left a little frustrated that, despite the attempts to, follow the advice of, diverse groups and panels, it's not been enough either. And I think we keep trying new ways and some of them yield some success, but until we're all coming together and promoting as a culture change at multiple levels, we're not going to solve the funding problem without solving the tenure problem or the education problem or the opportunity problem or the hiring problem. It's got to be a collective action.
Yeah, I agree with that. For me, it's really not an either or. And I know we call them pipeline programs. I think about them as pathway programs. I think they are necessary because people have to get their foot in the door. And so the programs that I manage, I think have been life-changing for the people that have benefited from them. I think they're not, what would you call that? They're not the only thing, right? That's just one of the things. So that's the only thing that, everything else you said, I would totally agree with. And when it comes to training and bringing in individuals I look at Dr. Singleton. She participated in our Endure, and now she's a D-SPAN scholar. Creating those networks, creating that environment, creating that self-efficacy as a scientist, that is so important. For the other comments that you made, I agree. It is about structural racism. This biomedical community is just a microcosm of the society. We have not solved the problem of racism as a society. We certainly aren't going to solve it in biomedicine, but I think every day we try to come at it in ways where we can get better. Particularly at my institute, one of the things that we've been really looking at is in the terms of, or with respect of the programs that we run, the panels that we convene, the study sections that are internal. Really, as you said, Dr. Jordan, looking at the composition, looking at who is reviewing these applications. All institutes have the ability to look at things at a second level of review and to have conversations about the composition and their portfolios and what we're funding. And we are having those conversations. Is it enough? Probably not, but we are thinking about it and we're trying to address it. I think when it comes to, topics of the science, I think that is also an ongoing conversation that internally at NIH, not only internally, but externally in terms of the advisory committees that we have. People are fatigued with this waiting. They want change and they want these outcomes to be measurable. And I think that is happening. But yeah, as I said, I would just say, we need to be doing all of it. It's not an either or. It really is a real holistic view of what it's going to take to change, because humans are involved in this process, and that's where you get these things showing up. We like to think of science as this very pure system, that there's this only everything funded is meritorious and it's the best, and and that there's some sort of pureness to the decisions that we're making, but they're inherently full of implicit and explicit biases. And so it is a conversation that has to happen. And I think, as I said in the very beginning, it's going to take all of us. Like the finger pointing it goes around every level of what it's going to take to really make a measurable difference and achieve really desirable outcomes. And I think the benefit of diversity, I think I also say, yes, I agree. The benefit is to the impact it can make on these communities and seeing someone like yourself. But it also, don't forget, it's not just as though having diversity benefits the diverse. It benefits innovation, it benefits the science itself. And so it is not only about the benefit that it conveys to minority groups, it's the whole enterprise that loses out when we don't have representation.
Thank you for that. I think since we're short of time, I'm going to encourage folks to chime in on this topic in the online chat. There's a lot of issues I think that sort of intersect around these themes. I mean, there was one great one on very related to what we're talking about now, really kind of how to balance systemic change versus training, mentoring, kind of adapting and optimizing to the system. And I think that's the gist of what we're talking about here. How does one really kind of overturn an inherently flawed system while still navigating through it as it is now? And so I'd love to hear folks be able to contribute to that in the discussion. It's a big topic. Hopefully you can do it in a text box. And I will turn it over from here to Gentry. But first, on behalf of the my co-chairs and the National Academies, really kind of thank all of the panelists from both panel 1 and 2 and all of you for contributing to a robust discussion. So Gentry, I will leave it to you to close out.
Yes, Thank you. Thank you to all the panelists. This was fantastic. This is a space and a time where it's hard to really dig in and think about where we need to go. I really appreciate the transparency by everyone. You know, this is our community and we have to solve these problems. And I think there was a lot of things said today that should really get people thinking about what they should be doing in their own spaces, at their own institutions. And if you come away from this thinking, wow, well, you know, we still have a lot to do, that's the truth. We have a lot to do, you know. There's a lot of work to be done, and I hope that we're all up for that challenge. And so thank you to all the panelists. Please go on to the online forum where we will continue this discussion and we can have some more pointed, directed question and answer from the audience as well as the panelists. Thank you to all the collaborative members for helping put this together. This was fantastic. I think that's about it. I think we should get over to the online forum. Is there anything else that we should be thinking about? Nope. If not,
I think just to let folks know that you can direct questions directly at a panelist by including their name, or you can ask them then generally, but the panelists will be available at least for the next hour to answer those questions. But please, specific questions, general comments, all of it is good. So we hope that you'll continue the discussion.
Great. Thank you guys. We'll see you over there.